Hello everyone. Good morning, afternoon, good evening everyone. This is Lionel. I just wanted to catch up. It's been a little while since I've done a podcast. And I just wanted to check in a little bit. The podcast is doing really well, so I really want to thank those who are listening. It really does make an impact on our life. And the purpose of this podcast, it's called Getting to Know We, is to let other people out there know that they're not alone with mental health. They're not alone with having dissociative identity disorder, and to help destigmatize it by telling our own story. So part of that story right now is being in treatment, currently in a treatment facility in California. Highly recommend California. I've been to a lot of different states for mental health in the last 2 years. And California seems to have the most resources that I've found. And one of those resources, very specifically, is inpatient. That's where I'm at right now, inpatient facility, meaning it's a step down from the hospital, because you have your crisis intervention, which is at the hospital, which is where, at least in the facilities, the hospitals that I was in, is when I wasn't on medicine, so it's mostly medication management and crisis intervention. So like for me, I was homeless and didn't have medicines, didn't have access to health care. I was undiagnosed epileptic with also mental health, so I was having a really hard time. And so I was in the hospital for about a month and a half. They wanted to keep me longer, but they gave me the option to go inpatient. They said, hey, we found a facility, would you like to go? And so I went, and that was like 6 months ago. Now here I am again at an inpatient facility. And what's interesting about DID, at least I can only speak from my perspective of it, is I'm going to always be in these facilities pretty much the rest of my life. And that is what I'm dealing with today. And what the topic of today is treatment and what that's really like. So I'm currently at an inpatient facility in California, as I said. And it's very nice. It's a very nice place. I have a bed with a roommate in a house, so it's residential, meaning that you live in a house with other people who are also in treatment. You have staff on site 24/7, so you're under surveillance 24/7. Crisis intervention is 24/7, so for me, I've had to implement that a couple times. Medication management is on site, so there is a psychiatrist and a nurse and even a doctor that are on site, or at least on site at least once or twice a week. And then there's also therapy on site as well. And so that's what it's been like for 3 days. So during the day, you wake up, it's very relaxed. I like inpatient being relaxed because I'm going through a lot right now. I'm having a lot of hallucinations, and it's auditory visual as well as a lot of flashbacks, reliving a lot of trauma. And so with that really takes up most of my day. What I'm supposed to be doing during the day is go to groups, so they have group therapy as well. And the group therapy, you talk about things like emotional regulation, certain types of therapies like CBT or DBT, which I can talk about more if people are interested. Just let us know. And I'm learning a lot about coping skills. It's really the main thing with the type of disorder I have and our system has. We deal a lot with PTSD. That's really the main thing, right? Main reason why we're here, as well as medication management, and we were homeless. So being homeless and having a job really wasn't working for us, so that's kind of how we came to treatment. We were homeless in Virginia, and we struggle a lot with staying stable, especially being homeless. Like, that's kind of like the thing, and that's why inpatient's so important, is because it's kind of like a hierarchy of needs situation where once your basic needs are met, you can really dive deeper into like the trauma or substance abuse problems and find the root cause of them and work on them and spend time out of your life, away from work, away from society, and just focus really on your treatment. And that's what we've been doing. We've been here about 3 weeks now, and we're really just now getting into the part of treatment where we can focus specifically on the root cause. And what that looks like for us is pretty intense. We have very intense trauma history. So like today, for example, I'll just give you the lowdown of what I remember, because we have blackouts, so means memory gaps. So when an alter takes over the brain and the body, and when that happens, due to amnesia barriers, I don't know what happened with the body. And so that's why I like the 24-hour surveillance, because they can tell me if I was safe, if I was doing anything I shouldn't have been doing. They also have cameras here so they can watch us. And so that really helps me, because when I black out, I'm actually in a safe area that when the blackouts happen, I have people who can take care of me and make sure that the body and the other alters that are present are taken care of. So that's been really nice. And so today, for example, I woke up. Due to a flashback, I was having a really hard time. And so I got to walk into a room, like an office, and ask for the psychiatrist and ask for medicine. So I took medicine and I blacked out for about 3 hours. And that was most of the day. That was most of the group time, so I wasn't really in my groups today. So today was just a really hard day, but I got to go for a walk. I talked to the psychiatrist, and she's like, let's go for a walk, trying to implement coping skills. And so it was really nice to have support, and nice to have people who actually care, people who actually have a lot of compassion and love for you. And I've gotten nothing but positive vibes from this place. Most of the problems that I am having are my own problems. It has nothing to do with the facility, but it has everything to do with me. And so for me, for a little while, I really wanted to leave treatment. I'm still contemplating leaving treatment. After completing this stage of treatment, what normally happens is you go a step down. So you go from inpatient residential to partial hospitalization. And partial hospitalization is essentially the same thing, except you have a little bit more freedom, meaning that you can't go off premises right here without staff present, whereas at PHP level or partial hospitalization, you go off site for your treatment. So the psychiatrists and everything aren't where you live. It's separated. So you kind of live in a house, residential facility house, that still has the 24-hour supervision, but you're allowed to walk off the premises, maybe go for a walk. You're given more freedom with your phone, so you can kind of have your phone all the time, whereas here, I can only have my phone during certain hours of the day after groups. And that's been my experience. I've been in PHP once before, and it was really nice. I got to go for walks. I got to take a lunch break and walk around town. I had access to my wallet and everything, so if I wanted to go buy something, I could do that. And it was nice to have the freedom, but also live rent-free at a facility and still get the treatment that I needed on site. And so what you really do in PHP as well is you do a lot of groups as well. Group therapy is like 9 in the morning to like 5 in the afternoon. And then you have a lot more responsibility. So it helps you really kind of attune back into society. So they make sure that you have chores. They make sure that your bed is made. They make sure that you have all of your responsibilities completed. And then if you do, then you can actually continue on with your day and your life and have the freedom to go off site and go for walks and go buy a Starbucks or something if you want it. And so that's where I'm at right now, is I'm kind of about ready to go to this PHP or just skip that and go directly back to real life. So that's where I am in my treatment right now. Since I've done PHP before, I'm really contemplating whether or not it's the right fit for me, because right now I'm on disability. So I'm getting paid a certain portion of my paycheck a month so I can pay for bills, but also get the treatment that I need. And so for me, that's been really nice because I'm living rent-free. So a lot of my money can actually go towards my debt or go towards the things that I need to take care of, like my mental health. I have a lot of hospital bills, so I need to pay off some hospital bills and stuff. So that's been what I've been doing. I haven't got the check yet or anything, but I've kind of been avoiding responsibilities because I haven't had the money. Actually, I have like $100 to my name right now, so it's been pretty scary. But yeah, that's just a tidbit on what treatment's like. And then once you complete and graduate the partial hospitalization, you can then go to an intensive outpatient, which is essentially you live in your own home or sober living and go to groups and kind of mimic the PHP. And that's the last phase before you're kind of entered back into regular society. So it's a nice system, but I have certain needs because we have intense trauma history. We really need that intense trauma treatment. And unfortunately, they really don't have a lot of facilities that can implement that type of treatment, at least that I've been able to find, because our disorder is relatively rare. Not as rare as people think, but it is, as far as it requires a lot of training in therapists. And what I've found is I really haven't found a lot of therapists trained in DID. They're really, like, I've seen it a couple times, but I'm willing to work with you and go at your pace and work on it with you, but I haven't seen it a lot. It's kind of the phrasing that I'm getting. And that's just my own personal experience. I'm not saying that's everybody's experience, but that's just my own. And so yeah, that's where I'm at right now, is just dealing with that and working on that and working on myself a lot. And it's been really nice. It's been really nice to have a roof over my head and food in my stomach, because I haven't had that for several months. And I'm making music. We have altars that are making a lot of music while we're here, so that's been really nice. So yeah, just a place, safe space to work and work on yourself and learn some new things and some coping skills. So I just wanted to give a check-in as well as a rundown on treatment. So that's today's topic, and please let me know if you have any questions. Please like and follow. This will be posted on Spotify and YouTube. Our YouTube channel is Anonymous Beats. There's a couple channels that are called Anonymous Beats, but ours is Anonymous Beats 8. That's our handle, where we post our music, where we just recently posted one of our songs that we created here in treatment called Moonlight. So check that out if you would like. And yeah, thanks for tuning in. That's all I have today. I try to keep it short. Try to keep my podcast under 15 minutes just because I have a really short attention span. And with that, I just want to say thanks for listening. And I hope you all have a wonderful and lovely week. And I will see you next time.